Well, good morning, everyone. And once again, welcome to another live, soon-to-be podcast. The doctor is in. Good to have you on with us this morning. I'll just wait a moment or two and say hello, bonjour, to our dear friends. And thank you very much, Nativity and Bernice and Nick from our administration staff. Diane, good morning to you. Rosa and Marin, we appreciate it. And Jocelyn from Sturgeon Falls. Lucy, good morning to you. Much appreciated, guys. We always do that. Sherry, okay. Mike from Wawa. And let me see here. Diane, good to have you on with us. We appreciate it, guys. David, how are you, David? Good to have you. Jerry, bonjour, and go Habs go. Absolutely. Denise, I'm going to tell you a little bedtime story, okay? Nellie, Andrea, good morning to you, okay? And I want to go over this chart that I have here. And we're going to talk a little bit about metabolic syndrome this morning. But I want to tell you, John from Elgin, Illinois, and Lisa, so many from Aurora, and Sharon from Nova Scotia, and Darlene, good morning to you. It's great to have you on. Natalie, how are you? Okay. Lola from Timmins, great to have you. Diane, another Diane, of course. Connie, good morning to you, Connie. Okay, big crowd on, and we appreciate it. And we ask you to share this after. Share it with your friends and share the teaching, or get them to sign up to our podcast. Okay, you can, if you've got a smartphone or you listen to podcasts, then sign up for the Doctor is In podcast. We appreciate it. Well over 2 million downloads thus far on that podcast, and we appreciate it. And millions of views on our Facebook. And again, that's because of you guys. You've made our book, the reset, the metabolic reset, the diet your doctor won't share with you. You've made that the #1 health book. I believe in North America. It'd be very close in numbers for the United States, definitely in Canada. We appreciate that. Okay, now, I want to tell you a little story. Once upon a time, you remember that? I remember telling, if you ever read stories to your kids or your grandchildren, once upon a time, I don't know, do we still do that? We should, right? Once upon a time, okay, there was a plague, a virus that only killed people who had trouble with insulin. Once upon a time. Are they ever going to do that and tell stories about this virus? And my biggest problem with it is twofold. And I've mentioned this so many times, but I'm just going to say it again, okay? We miss, #1, the elephant in the room, okay? With very few exceptions. The only people that got really sick or died from the virus, very old, well over 80, and pre-existing conditions. But the pre-existing conditions were all based on one condition. Because they just say it, pre-existing conditions, right? Like heart disease and high blood pressure, but they don't go into detail as to why you would have heart disease and high blood pressure that would make you much more susceptible to this plague. It's the metabolic syndrome. Remember, 88% of the population is metabolically unwell. Now, that doesn't necessarily translate into 88% of the population is now at severe risk of, because if you're young, if you are a young person, generally this plague hasn't affected you. Generally. Okay, it's always exceptions, guys. I understand that. But what they miss, okay? Remember, I have two pet peeves. One, they miss the elephant in the room. Metabolic syndrome. We'll talk about that this morning. We'll go into a little bit. That's all due to insulin. It's all due to food. It's crazy, but it's all due to food. And the second peeve that I have is the first time in recorded history that I can think of, and maybe you guys could, clear this up for me, is the older generation, me, more worried about me than the young people. More worried about my health. My health. The screaming that's taking place, let's close it down. Let's keep it closed. Let's shut it down. Let's not go back to normal. The cry is coming from older people because they're scared. Fear is driving the agenda, guys. But fear for my age, you see, like generally over history, and you guys would agree with this. I don't think there'd be anybody that would disagree with this. I'm a father, I'm a grandfather, and I'm a great-grandfather. And I just tell you, innately, I think you're like this. I'm more concerned about my children, especially grandchildren. Grandchildren. Oh, I love my grandchildren. I love my children, of course. But it's different. If you're not a grandparent, you wouldn't understand it. It's just that it's instant love. It is like the can't help it. Grandma doesn't say no, and neither does grandpa. It's my grandchildren. But it's not meant to be, guys. Once upon a time, we have a plague or a virus that we put the older generation first. Now listen, not that we shouldn't respect the older people. I hope you respect. We have a health and respect. Somebody said to me several months ago, I said, well, we should protect the vulnerable, protect them, and not affect the rest of society. And they said, Doc, you're part of the vulnerable. Nah, I don't see myself like that. And I'm going to tell you why. Okay, so the twofold. And this is really important, guys. In any chronic disease, I'm sort of preparing, I'm going to lecture on tomorrow to the University of Tennessee psychology students, and they're talking about chronic disease. Okay? And the diet with chronic disease. Now, let me just, you guys know this, but I'm going to teach it to you again. What is metabolic syndrome? How do you know if you have metabolic syndrome? Okay? There's really more than 5, but I'm going to just mention 5 and then maybe mention one more because they don't put it in there, but I think it's important. Okay? You have metabolic syndrome if you have 3 out of the 5, and I'm going to mention 6. Okay? But according to medicine, if you have 3 symptoms out of 5, okay, you have metabolic syndrome. Look, number 1, look at your belly. Go to the mall. They're closed. At least in Canada. Mostly, right? But use your eyeballs, guys. Observe. What do you see? What do you see? People are big. Comparatively, watch an old movie. People were tiny. Okay? If you left at a planet in 1970 and you come back to planet Earth, let's say you went up to Mars with Elon Musk, you took one of those spaceships and you're going to go live in Mars and you came back, what would you observe? Think of it. Just be observant. People are so much bigger. They're waste. If you have a bigger waist size, you have metabolic syndrome. It's the number 1 symptom. The number 1 sign that you have metabolic syndrome. Look at your belly button. We used to call them beer bellies. Beer bellies. They're not beer bellies. They're sugar bellies. Metabolic syndrome, 88% of the population have metabolic syndrome. Not according to Dr. Martin, but according to the CDC. 88%. Only 12% don't have 3 of these things, okay? What's number 2? 1 is elevated or a bigger stomach. It's the waist size. Your waist size. 2, high blood pressure. What is it? What are they saying now? 60, 70% of the population have high blood pressure. Wow. High blood pressure is not caused by salt. It's caused by sugar. It elevates your insulin. You get insulin resistance, and your blood vessels are affected by that because for 2 reasons. 1, your kidneys. Your kidneys are hypersensitive to sugar. Sugar is toxic, guys. Sugar is toxic. So if you have high blood pressure, which, what are they saying? 60, 70% of the population in North America have high blood pressure? My word. Every 38 seconds, someone in the United States of America has a heart attack. Every 38 seconds. And we're talking about a plague that affects old people. But we're not talking about metabolic syndrome. Waist, high blood pressure, either from the kidneys or the damage to the Teflon layer of your blood vessels. The damage to the Teflon layer of your blood vessels. Your blood vessels have a sticky layer, a non-stick layer, excuse me. Okay? And that Teflon layer gets damaged by sugar. It gets damaged. damaged by high blood pressure. Okay? Third one is elevated blood sugar. Now listen. Oh, Dr. Martin, you know how many times I heard this? 20,000 times in my practice. It would be, yeah, for sure. I'm not a diabetic. I don't have high blood sugar, according to my doctor. Yeah, but you have elevated blood sugar anyways. It may be normal according to your physician and according to the lab, but if it's in the higher range, even slightly higher, you have metabolic syndrome, elevated blood sugar. We live in a society today where this is an absolute plague. People have elevated A1C, which is an average of your blood sugars. It's elevated, still within normal limits according to the lab, but it's too high. It's damaging your blood vessels. Okay? Got that? Now, I tell you guys all the time, you want me to look at your blood work? Happy to do it. What am I looking for? I like your A1C. I like looking at that. It gives me info. Don't give me your total cholesterol, all that. I won't comment on it. I'm sorry, I just won't. Oh, doc, my cholesterol is high. Oh, good. But I want to see your triglycerides, okay? So if you have elevated triglycerides, and it's like a teeter-totter, it's almost 100%. If you have elevated triglycerides, 3 fat balls are triglyceride. This is one of the most important things you will ever get. Like somebody sent me blood work to look at yesterday. I didn't see their triglycerides and I didn't see their HDL. And I sent a note back to them. I said, what do you want me to comment on? I'm not commenting on stuff that's not important. What's important, I need your triglycerides and your HDL because that tells me a huge story of metabolic syndrome. You better have low triglycerides and high HDL, high density lipoprotein. It is cholesterol. You want to live long? Have good cholesterol. Have high cholesterol. Your HDL. Dr. Martin, what about LDL? I don't care. Don't mean nothing to me. You want to give me your LDL number? I don't care. I don't look at it. I don't spend any time on it. It's not giving me information. LDL is the cholesterol called low density lipoprotein. And the reason that it's significant in this world is because the pharmaceutical companies made it significant because they found a drug that can lower LDL. Whoopie doopie. Oh, I lowered my LDL. I remember there was an old commercial of a guy, he was a firefighter and he's going down the pole at the fire hall and then he comes down and he goes, I lowered my cholesterol. I lowered, giving everybody a high five after coming down the pole. And he's going, I lowered my cholesterol. Well, youpie doopie. Who the stink cares? What's that got to do with health? Nothing. Especially you older people out there. You don't want to have low LDL. You want to die young? Then have low LDL. Guys, this is key because as a lay person, You can look at your own blood work. What are my triglycerides? What are my HDL? And I don't want you to fight with your doctor, okay? No fights. Don't fight with your doctor. But you know, the days of not knowing anything, you know, because my generation, and especially my parents' generation, they go to the doctor, and doctor was God. I had a good friend of mine in Quebec City. He, you know, because he was a friend of mine, I just, you know, I talked to him about his mother's medication, okay? So his mother was 82 or 83 at the time, and this friend of mine from Quebec City, Andre was his name, I said, Andre, go to the doctor with your mother. And I pumped him up. His mother was on 26 pills a day. I said, Andre, 3/4 of those pills are for the side effects of taking the other quarter of pills. And they just stopped. He said, my mom's a zombie. Yeah, I said, go and fight. They might be insulted for the first minute or two, but just say, no, I'm not leaving here till you show me exactly why my mother is taking every one of these pills. The average person over 65 in North America, listen to this, the average North American over 65 years old in North America, they're on 7 different medications. 7 over 65. I love pharmacists, I do. I was picking up something, several months ago, and the pharmacist said to me, okay, and I knew them because they were a patient. You don't take any meds? I said, well, yeah. My food is medicine for me. Now, I'm not against meds, okay? Please don't come after me. I won't respond to you if you say, well, that's stupid. No, I'm not saying you don't take medication. I'm not saying that. But how about prevention? So if you look at metabolic syndrome, waist size, high blood pressure, 2, triglycerides, 3, HDL, 4, okay? Those are the signs. Did I give you the, hold on, let me just, what did I just say, okay? That I don't want to miss anything here. Waist size, blood sugar, triglycerides, HDL, and high blood pressure. Those are the 5 signs. Now, the 6th sign is uric acid. Now, you won't see that in most references to metabolic syndrome, but I like to include it if you have elevated uric acid. And, a lot of people think of uric acid as gout. And yeah, for some people, that's how they manifest it. But uric acid can elevate your blood pressure. And you don't get high levels of uric acid unless you are a carboholic. Metabolic syndrome is a sign that you are a carboholic. My name is Tony, and I'm a carboholic. If you don't admit it, anything you ever learned about addiction And that's why they have the 12-step programs. One of them is you got to admit it, right? Like, I am Tony and I'm an alcoholic or whatever it is, right? And I'm a drug addict. And a lot of people are drug addicts and they're prescription drug addicts. They can't fall asleep without Ambien. They can't fall asleep without Ambien. I said to a lady the other day, I said, "You're taking Ambien? You're taking the medication?" "Oh yeah, I've been on it for about 20 years, doc. I can't sleep without it." I said, "You're not sleeping. Have you ever had an operation? Do you think they put you to sleep or did they sedate you? They didn't put you to sleep. They knocked you out. Big difference. Because when you're sleeping, your body is actually repairing, especially the brain. The brain works, the repair in your brain works when you're sleeping. It's called the glymphatic system. It literally takes out the debris out of your brain and regenerates the brain. But not if you're on Ambien. Because now you're sedated. You're not sleeping. "Oh, doc, I'm sleeping." No, you're knocked out. That's a big difference. And sleeping meds were meant to be temporary. If you ask any pharmacist, and I'll just tell you a little pet peeve of mine. Pharmacists are the ones that should be calling the doctor. They're the professional, and I'm upset with them because they're not doing their job. They should be calling the doctor, said, "You know what? This is the 4th prescription now, renewal of Ambien for sleep. You know what? They're not really sleeping. You're sedating them. And I don't recommend that you keep a person on this drug for a long period of time." That's what a professional should do. Like, no, I know all about these drugs. Pharmacist. I know all about these drugs. I know all the side effects of these drugs. But you know what? They become dispensers today. They're not doing their professional job like they should. They should be the one calling the doctor and questioning the doctor on your behalf. Really? Hey, this person has been on Prozac, antidepressant, and SSR receptor medication for 20 years. Wasn't meant to be, doc. Wasn't meant to be. You got them on ACE inhibitors for how long? And there's a lot of side effects to that, doc. Do you think that maybe perhaps we can look at something else? You can see why my blood pressure gets going. Because, look, guys, I'm a professional. I'm supposed to do my job. And once upon a time, you can imagine, they'll be telling stories about the world got brought to his knees by a virus, and I think people overreacted to it in the wrong way. Because they weren't looking, number one, at the vulnerable population, one. And two, they weren't looking at the elephant in the room, metabolic syndrome. And, I mentioned this maybe last week or the week before that, okay, no, we're out of time. I'll do this tomorrow. But I want to talk about the immune system. The immune system. Nature's immune system. Your body, guys, is fearfully and wonderfully made. You have an immune system. I will show you tomorrow some of the basics of that immunity. So one of them is metabolic syndrome. I hope you understand that. Metabolic syndrome, guys, is food. It's not anything else. It's food. It's insulin and insulin resistance, meaning that your cells at the cellular level hate insulin and they resist it. But insulin is a bully. Okay? Insulin is a bully, guys. It will bully the cell. You open up. I don't care. I'm going to come at you with all I have. Insulin will do its job until it can't. And that's diabetes, according to medicine. But you see, if you have insulin resistance, you really are a diabetic without the diagnosis. Do you know what? Millions and millions and millions of people who think they're not diabetic are diabetic, because if they have metabolic syndrome, they're diabetic. They have a big belly, they're diabetic. Oh, my blood sugar is normal. No. I have high triglycerides. You're a diabetic. I have low HDL. You're a diabetic. I have uric acid, high levels of, you're a diabetic. I didn't even talk to you. Another factor in metabolic syndrome really would be number 7. And they don't put it there, but it easily could be, is fatty liver. Because, listen, you don't even get high triglycerides without fatty liver. The scourge of the 21st century. Your liver. There's nothing that destroys your liver more than sugar, because sugar in the liver turns to fat in the liver. And when your liver is full, when that suitcase is full, it's going into your bloodstream as bad fat. 3 fat balls called triglycerides. It ain't cholesterol, guys. That has been brought to you by the pharmaceutical and the food industries. 100%. And I won't apologize for saying it, because it's the truth. And the truth in the Bible says, then the truth will set you free. Look in the mirror and say, I'm a carboholic. First step. Because you can't get metabolic syndrome without being a carboholic. It's an impossibility. It's a food hormone. It's insulin. Once upon a time, okay, let me read this story to you. Once upon a time, there was a plague or a virus that had everybody looking at the wrong cure. Once upon a time. Okay. They're going to make movies about this. Okay. Okay, guys. Really appreciated your time today. If you are not a member of the private Facebook group, please join that wonderful community of people. 90% of the time, I don't have to answer, or even the administration, our staff, doesn't even have to answer these things, because the people answer them. They're often quoting me in there, and that's good. That's good. I appreciate that. And we appreciate you guys, and we want you to join that community, the Martin Clinic private Facebook group. Remember, the Metabolic Reset is in stock. We have it for sale. We appreciate that too. thank you so much for making that book such a success, a tremendous success, okay? So enjoy the rest of your day. We love you guys. Talk to you soon.